afternoon, ladies and gentlemen. Welcome to Corporate 24. Today we are actually celebrating World Pharmacist Day at Corporate 24. My name is Vusi Moyo, the Marketing Manager with Corporate 24. And today we are actually going to be talking a lot more about our PhD program in chronic diseases management. So I know that most people might have heard about chronic disease management. Some already know relatives and friends who have chronic diseases, and you might now be wondering, what is this PhD program all about, and what is Corporate 24 also all about? So what I'll do, I'll just do a brief introduction of who is Corporate 24, what's Corporate 24, and then after that I'll hand over so that we get to learn from our pharmacists themselves, our pharmacist herself, on chronic diseases management and the PhD program that we are launching today. We have an exciting and amazing program. If you know a relative who has chronic diseases, this is a very amazing product or program that we are going to be running. It will help manage, it will help control, it will also help bring support to people that could not or would not be otherwise able to afford the kind of support services that Corporate 24 actually offers, especially at the pharmacy. So today we are going to talk more about Corporate 24 Pharmacy and the PhD program run by Corporate 24 Pharmacy. So for just beginning, just to introduce you, Corporate 24 Healthcare is one of the leading health brands in Zimbabwe. We are now 15 years in existence in Zimbabwe's health market. We have 2 branches in Bulawayo and Harare in terms of hospitals. They are grade A hospitals, which is like the highest level of hospital in the private sector. So in our hospitals, we operate as a one-stop center. We have our own ER, which is our emergency room, maternity surgeries, ICU, pharmacy, laboratory, radiology, and other things. But most importantly for today, Corporate 24 Pharmacy. So we operate in Harare and Bulawayo, and then we also have a division for medical aid, and you learn more about it. Actually, we launched a new product recently called My Plan. You will hear about it in the streets of Bulawayo soon. We actually have a road show, I think, scheduled for this very week, Friday. But today, it's all about Corporate 24 Pharmacy and World Pharmacist Day. So before I also give to you, I just want to give you context so that you understand why this is an important thing. Chronic diseases are those kind of disease that you have to live with, right? It's not something that's going to be healed and somehow it disappears. So it's gonna stay with you. So support services for a disease that you're gonna live with for a longer time is so important, because they are not like those kind of medication you take and you stop.
I'll take from the other extreme. There are people who are underweight, right? People who are underweight are likely going to develop their own set of problems. So much so that people who are also overweight are likely going to have their own set of problems. We cannot then take away from the fact that there are people who have challenges with losing weight or challenges with gaining weight. So weight is it's like that thing at the middle that affects most of the things that we then suffer from, especially when we're looking at our least likely chronic diseases. Diabetes has got some weight element in it. BP has some weight element in it. But being skinny doesn't mean you are never going to have BP or you're never going to get diabetes. So it's not necessarily how you look. There is a body mass index has got a relationship between your height and your weight. So there's no 60 kgs is the best weight or 90 kgs is the best weight. There's a relationship between your weight and your height. Do you know who just collapsed on their way to work? We hear them. He was young, but he just died. I don't think, okay, maybe there are wizards and witches out there, but sometimes we've got hypertension, which is what we commonly know as BP, is called a silent killer. It means that headache you're ignoring or you're taking ibuprofen for, it could be BP. So the higher your BP readings go, it means the higher the chances of you having a stroke without even knowing that you had BP to begin with. So we're saying, as long as you are a sensible person, you should know your vitals. So the first step is realizing that your health is your responsibility, and you can be a PhD holder. You move around with this, know your BP, know your BP readings, your blood sugar levels, which we call the diabetes test, know your weight. How much do you weigh, sir? You see, you don't even know your weight. Some people don't even know their height, which is unfortunate. You should know your weight, you should know your height. In case you gain 10 kgs, that is unexplainable. Maybe you have other medical conditions that have triggered that. You know where you're starting from and where you've ended up. But if you don't even know your weight, I think we have a lot with regards to health education that we need to do as a country. So we're just encouraging people to know those things. And if some of you are comfortable, you can go to the pharmacy. We have got what is called the BMI machine, body mass index. So people hate that term because it will tell you you're obese when you think you're not very heavy. Let me put it like that. There are other readings on a BMI machines that I think are important to you and me. For instance, there is a reading called the visceral fat, that is fat around our important organs. That is more important than how much you weigh, although it is somehow related, right? So when you come to the pharmacy, when you've got close contact with the pharmacist, with the doctor, there are other readings or other things that you need to know about your health that they will tell you. If you're coming every month, I'll now note this guy has gained weight. This guy, his BP is now slightly on the rise. What could it be? We investigate. We give you lifestyle changes to take up, or what we call an action plan. We can change your diet. We can change a lot of things that we do together. So it's all about you making a conscious decision that I now want to be in charge of my health.
We can manage these things for free. We are not charging these people who are coming to our pharmacy because we have realized that by the time the things are advanced, the chronic conditions are advanced, there's literally less you can actually do to help people. So we've partnered with Bulawayo City Council. You will see some of our programs running after this. So that we actually give more information to the public. We'll be going to literally every BCC clinic in Bulawayo to go and share this information, and then to other companies and other communities. Please kindly remember that even last month, we actually were supposed to start this program last month. It was actually the Chronic Diseases Awareness Month, and part of the reasons that we were actually coming up with this is because, as she mentioned, sometimes you could be just walking and then they hear you collapse and you die. People don't understand that you need to have a PhD in chronic disease management of your own body, which is why I'm wearing like a PhD student today, because you need to have a PhD in your own health. You need to understand your body and you need to understand the various things that are happening. That's why this thing actually keeps track of everything. By the end of a year, you'll now be understanding that when you are shaking like this, when this thing is happening to you, it's because of this. So we're actually offering our pharmacy as a staging point for the free access to support services for everyone with chronic diseases. Usually you would have had to pay to come and get support services from our pharmacy, but now you come, you can get tested for sugar every day to fill up this thing every week, and then they will test you for all the other things that they need to be doing. Come to Corporate 24, they will do it for free, because the goal for us now is not just money, but now the goal is to how to empower everyone to understand that health is a serious thing and it cannot be done at an individual basis. We need to partner up with other organizations We are already in talks in partnering up with other hospitals, because like we always say in the health industry, it's not about competition, it's about how we can help our community, how we can build. So it's starting here at Corporate 24, but it's not ending here. We'll still be empowering other of our health partners to come through, and then our city and our country can become more health conscious, and then maybe more people could become like me and have a PhD in their health.